Contact tracing is one of the many important tools health departments are using to try and slow the spread of coronavirus. But in order to do that, they need to know who is testing positive. We talked to a few health departments who say those results are taking too long and sometimes not happening at all. In most cases, your COVID-19 test is processed in a matter of days. But it could take even longer for your local health department to find out about it.
I'm not sure if they're reporting to the state or anybody. I mean, as far as jurisdictions go, they kind of sit at the top. So I don't know if they're just reporting their numbers up and not necessarily down.
Director of Planning and Development, Matt Wyant, says when people in Pottawattamie County take a test in Nebraska, it can take even longer, and in some cases, not at all.
We did have a few different individuals that came to us who had informed us that they had tested positive at the VA hospital, and we tried reaching out through the VA hospital and different contacts and submitting different forms, but to get the test results back to go into the file was we weren't able to meet that criteria that was being set forth for us.
We reached out to the Omaha VA Medical Center. They informed us their policy is to report their results to whatever state health department the patient lives in. But Wyant says they never received that information.
So what we had done with them was we took them for their word on it that they had tested positive, and we added them into our tracking system as well.
We spent weeks calling and sending emails to members of the state health departments in Iowa and Nebraska trying to get answers. Eventually, both responded with emails saying all positive results are reported to the state health departments the person lives in. From there, the state is supposed to notify the county health department the person lives in. One person with the Iowa Department of Public Health told us it's a manual process, which means there can be some delays. That person told us, at most, it takes a few days, something that may not seem like a long time, unless you're trying to contact trace.
It's important to help us get those members into isolation that need to and notify the contacts that may have been in contact with those individuals.
And it's not just making sure they're able to find everyone who may have been exposed. It's also about preventing others from getting sick, like police, firefighters, and EMTs.
We update our list constantly with all the addresses of those individuals. So that way, if first responders have to respond to that address, then they are aware that, hey, listen, there is a known positive at this residence, and they can prepare themselves.
There is no vaccine. Treatment is limited. All health departments can do is try to stop it from spreading.
The more people that come in contact with those positive cases, you can get them the faster you can give them the quarantine advice and recommendations for staying quarantined and or isolated, then that helps limit the spread within your community.
Communication is key, but right now, Wyant says that's not happening.
And I reached out to a couple of the other health departments and asked if they were seeing kind of the same thing, and they had been seeing the same thing. They were still trying to go through the paperwork to get those results, but hadn't been successful yet.
We emailed both state health departments several times requesting an interview. They have not responded to those requests. If you have a story idea for our investigative team, shoot us an email at investigate@3newsnow.com.